At the end of pregnancy, you will likely find yourself examining your toilet paper after each wipe to see if you've lost any of your mucus plug. While we're waiting for labor, we're just looking for signs that labor is near. And wouldn't you agree that the mucus plug is one of the weirdest things of pregnancy? And as a doula, I think actually that is now the weirdest photo that has ever been sent to me several times. Strangest and grossest is that of someone's mucus plug. But I do find it interesting. Now, what does it mean when you lose your mucus plug? Well, at the most basic level, it means that something is happening with your cervix. It's opened at least a tiny bit to allow for the mucus plug to exit your body. Because the mucus plug sits at the cervix, it serves the purpose of keeping bacteria out of the uterus. So while we don't know how open your cervix is, we do know that some small amount of dilation or opening has happened. Now, if you lose your mucus plug prior to 36 weeks, you should definitely let your doctor or your midwife know. Now, let's jump in to talk about the color. The color of the mucus plug can actually vary quite a bit, and it can tell us more about what is happening in our body. So it can be clear, yellow, pink, it can be red streaked, it can be brown, it can be greenish. The only color though that should be a concern to us is if we have that greenish colored mucus plug. So if you have a greenish mucus plug, it can be a sign that you have an infection, and I recommend contacting your doctor or your midwife to let them know what you saw. So all the other colors are normal, shouldn't be a cause of concern, but these three right here mean that there's also some blood in that mucus. So let's take a quick look at the anatomy. The mucus plug is found here at the cervix. And when the cervix dilates or opens, sometimes the capillaries here on the cervix will also break and small amounts of blood will come out. This blood can cause the mucus to turn that pink color, can be red streaked, or it can look brown if that blood is actually older. So when the mucus plug contains blood, it actually gets another name, bloody show. So losing a mucus plug that is clear, yellow, or lightly pinkish generally doesn't mean that labor is close. It lets you know that the cervix has made some change, but probably could be days or weeks until labor starts. If you see a bloody red mucus plug, it can indicate that your cervix is making more change, and that change might be significant. If bloody show comes out when you're experiencing cramps or contractions, then that could be more significant sign that you're in labor or that labor is going to be starting soon. Now, many people see a brown mucus plug come out the day or 2 days following a prenatal appointment where your doctor or midwife performs a cervical check, or maybe if you've had your membranes swept at your cervical check, it could cause some bleeding at your cervix, and that blood can turn brown before it exits with the mucus plug. So sometimes people think they're having some kind of opening in their cervix, but it's really just a result from that exam. Now, beside the color of the mucus plug, let's quickly talk about the amount, because this can also vary as much as the color. You might experience a large blob of mucus all at once. You might experience pieces over a few days or so. And don't be surprised if you see your mucus plug come out 2 times or more. The mucus plug can actually regenerate. I remember the first time I had a client call me totally confused because she lost her mucus plug and then lost it for a second time. So don't be concerned if you also never see your mucus plug come out at all. I remember supporting a client in the hospital who we had been laboring together for several hours. She started to feel the urge to push. She had a cervical check, and indeed it was time to push. Her cervix was 10 centimeters dilated, 100% effaced. And then she looked at me and said, "But I haven't lost my mucus plug yet." And we all started laughing. It is not necessary to see your mucus plug come out, and many people don't. So while we're talking about interesting things that happen in pregnancy, I know that you'll want to check out this video right here where I share all the details about water breaking. I also use water balloons to show you how artificial rupture of membranes is done. I know you're gonna like that one next. See you next time. Bye.